Okay guys, today we're talking about something that sounds kind of wild, but it's also super important for your health awareness. Chagas disease and the insect that spreads it, commonly known as the kissing bug. Before we dive in, let me tell you right up front, this isn't just some exotic disease down south. It affects millions of people worldwide, and the silent impact it can have on the heart and the digestive system is pretty serious. So here's what you need to know, and I'm going to break this down in a way that actually makes sense. Let's get straight into this, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people. So if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. So first, what exactly is Chagas disease? At its core, it's an infection caused by the parasite called Trypanosoma cruzi, and that parasite is carried by insects called triodamine bugs. People call them kissing bugs because they often bite around the face while someone is sleeping. And these bugs sometimes live in smoothies and juices that you buy in South America. In Argentina, it has a name called vinchuca. In Colombia, it's called pito. And in Brazil, it's called the barber. What most people don't realize is that the parasite doesn't enter directly from the bite. Instead, after feeding on you, the bug will often defecate near the bite site. And if that feces gets into your bloodstream through that bite wound, a cut, or even your eyes or mouth, that's how the parasite enters your body. Sometimes people make the honest mistake of itching the area, and that's how it gets inside you. Here's a number to put in perspective. More than 7 million people worldwide are estimated to be infected with this parasite. In parts of the United States alone, estimates suggest around 280,000 to 300,000 people are living with Chagas, many without even knowing it. Now, here's something that may shock you. Most people who get infected don't feel anything at first. The early or acute phase often causes mild flu-like symptoms or no symptoms at all. That's one reason this is so insidious. Many people won't realize they're infected until years or even decades later. And that leads us into one of the most important parts. What happens if Chagas goes untreated? This is where the numbers and science really matter. Without early detection and treatment, about 1/3 of the people with chronic infection develop cardiac problems, mainly arrhythmias, because the heart's ventricles enlarge and that reduces its ability to pump blood. And about 1 in 10 develop digestive, neurological, or mixed complication. What does that mean in real life, though? It means the parasite slowly infiltrates and damages the heart muscles and our electrical conduction system, which can cause irregular heart rhythms and lead to progressive heart failure. If you pause and think for a second, it's kind of crazy to think a bug can cause heart failure, but it can happen. And the impact doesn't stop with the heart. In a smaller but still significant percentage of people, the parasite affects the digestive system, leading to serious issues like the enlargement of the esophagus or the colon, trouble swallowing, bloating, or chronic constipation, conditions medically known as megaesophagus and megacolon. So this isn't just a nuisance. It's a parasite infection that can quietly move into critical parts of your body and cause severe chronic disease years later. And it's even crazier to think that a cup of fruit juice or a bowl of salad on vacation can cause that. Now let's talk briefly about how it spreads, because this part is important. Yes, kissing bugs are one way, especially in rural parts of Mexico, Central and South America, but that's not the only route. Chagas can actually also be spread through contaminated food, blood transfusions, organ transplants, and even from mother to child during pregnancy. It's also becoming easier for it to show up outside traditional areas because people move, so it's not just a tropical disease anymore. Cases have even been reported in parts of the US, these states mainly. You also have them in Europe and other regions too. Although it's more rare in the US, 11 triodamine species are actually native to the United States, and these are what they look like, guys. Kind of creepy if you ask me. They're about 1 inch long, and some southern states have persistent cycles of transmission between insect vectors and animal reservoirs too, from your wood rats, possums, raccoons, armadillos, and skunks. It's kind of funny to think that raccoons are actually close to becoming domesticated. Let me know if you have any friendly raccoons in your backyards in the comments below. Here's the kicker though. There's no vaccine for Chagas, and there's no magic drug you take before you get bitten that prevents it. The good news is that if you do get infected and it's caught early, anti-parasitic meds like benznidazole and nifurtimox can dramatically reduce the parasite load and in some cases eradicate it. Benznidazole is usually considered the first line treatment because it has less side effects. The tricky part is most people don't know they're infected until decades later when the damage has already started. So what can you do? If you're in or traveling to an area where kissing bugs live, simple prevention measures can make a big difference, guys. Improved housing with screens, so make sure your accommodations have insecticide-treated bed nets, and avoid being in places where the bugs can hide at night, especially in cracks in the walls. And if you find a bug in your home, learn how to safely capture and identify it, because if it is infected, your doctor will want to know about it. But here's the most practical thing you could do today: awareness and early testing. If you've lived in or traveled through regions where Chagas is common, or if you've noticed unexplained symptoms, just ask your healthcare provider about testing. A simple blood test can check for antibodies to T. cruzi. The sooner you know, the sooner you can get treatment before the parasite makes serious structural changes. Also, I want to add a bonus tip for you guys, and you might thank me later for this. Turn off outside lights at night if it's safe to do so, because kissing bugs might fly towards the lights and then crawl into your house. So keeping the lights off can keep the kissing bugs from coming near you while you sleep. If you learned something new today, go ahead and hit the like button, because that tells me you want more videos breaking down important science-backed health topics like this one. And if you've got questions about Chagas or how parasites interact with the human body, drop them in the comments. I'll do my best to answer them. Stay curious, stay informed, and I'll see you guys on the next one.